Please note today's session is being recorded. If you have any objections, you may disconnect at this time. Thank you very much. And on behalf of the National Cancer Institute, I wish to welcome everyone to the May Advanced Topics Implementation Science webinar. Today we are delighted to welcome both Dr. Greg Ahrens and Dr. Maria Fernandez, joined by our own Dr. David Chambers, to this campfire side session. A brief word about logistics and we'll be off. We ask that if you are not already on mute, to please keep your phone on mute for the duration of today's presentation. As mentioned, the session is being recorded and muting all lines will help us to avoid any background noise. We encourage questions. They can be submitted using the Q&A feature on the right-hand side of your screen. Type your question in the provided Q&A field and hit submit. Feel free to submit your question at any time. We will be moving through your questions and some we have for our presenters through today's presentation. With that, I will turn it over to David.
Thank you, Sarah, as always, and thank you so much to everyone who is joining us for the latest in our series of chats with leaders in the field of implementation science, and really trying to understand a little bit more about how has the field progressed, what are some of the key issues that we want the field to be focusing on, learning from our experts also in their experience in various aspects of conducting, of reviewing, of advancing implementation science. This month we have moved from the fireside to the campfire side, I guess. So we've encouraged everyone to pull up a log and join us for this. With me are Maria Fernandez, as you can see here, Director of the Center for Health Promotion and Prevention Research within the University of Texas at Houston, and Greg Ahrens, who is Director of the Child and Adolescent Services Research Center and professor at the UC San Diego School of Medicine. I had a chance to meet Greg, I think it was somewhere around 2002, 2003, when I was at NIMH. We had our, every other year, we had our Mental Health Services Research Conference. And I remember meeting Greg. There was a series of, at that point, earlier career investigators, many of whom were completing their career development awards, and Greg was among them. And he was one of the few people who really had not only the expertise around psychology and specifically focusing on children and adolescents, but was also twinning that with this interest in the organizational features that affect mental health services. And Greg very quickly became a leader, not only in mental health services research, but in thinking about dissemination and implementation research and implementation science. He's also, we've talked on previous calls about the rise of effectiveness and implementation hybrid trials. Greg was one of the first people that I can think of who basically thought about that idea before it became a thing. So I remember we were in San Diego, and Mark Chaffin from the University of Oklahoma had come and had this wonderful effectiveness trial that was ongoing about Safe Care, a child welfare intervention. And it was Greg who said, you know what, we have an opportunity to learn about implementation and then about sustainability while we're learning about the effectiveness of this particular intervention. And so I think he predated and really foresaw the rise of the interest in effectiveness implementation hybrids. Those of us in the mental health services field do miss Mark Chaffin, who we lost too early a couple of years ago, but we're grateful to Greg for really advancing the field again, both of effectiveness research and implementation, and becoming a great leader also in mixed methods research. I remember meeting Maria Fernandez at one of our early TIDER, our Training Institute for Dissemination and Implementation Research in Health cohorts. And Maria, who has tremendous expertise around health disparities, around thinking about cancer control, particularly around cancer screening interventions, was notable for also really thinking about what are the characteristics of different interventions that are going to make them more likely to be implemented, more likely to be disseminated broadly. And she, along with Kay Bartholomew, who we also miss dearly, have really led the way in thinking about intervention mapping as a strategy to try and understand what's the best way to customize different interventions to the populations, to the settings where they can be best implemented. Both of them have also tremendous expertise around the review of applications, having served as study section members. They've also been instrumental in really helping us think through advancing publications. And so for today, we're going to do a couple of things. One, we're going to just get a sense from their perspective how the field is advanced, and then drill in a little bit more into some of their perspective, some of their feedback around the whole idea of applying for, of receiving funding, as well as considering publications and the submission of publications, how they're reviewed by different journals, and how we can think about ways to just better advance the field. So, and there is our first campfire. So just wanted to start out, and maybe starting with Greg, just giving everyone your perspective. What was the state of implementation science when you began working in the field? And then Maria, we'll hear from you. Greg, you want to kick us off?
Sure thing, and thanks, David, for having us. I can feel the warm embers of the campfire. And yeah, I think when I started, I mean, I feel like there wasn't a body of implementation science per se, but there were folks interested in this issue of, how we bring evidence-based interventions into the real world and how we understand what it takes to support improvements in care on a large scale. And I think, you alluded to that meeting here in San Diego, John Lansford's network grant that brought a number of investigators together that helped bring up those issues of, yeah, we have these great interventions, or we're testing these interventions. How do we bring them to the field? And I think, your arrival at NIMH, and also I remember John Kerner at NCI, were instrumental in kind of driving and thinking about implementation research and implementation issues as a field of study, as something to focus on outside of looking at effectiveness. And so we'd be looking, at all the things that we try to control in efficacy and effectiveness trials, all the noise, all the problems we encounter in those kinds of studies. That's I think what we now study in implementation science. How do we bring effective interventions into clinics, into service settings, bring them to scale, and learn about how to do that more effectively. So, the field was nascent when I began, but it has developed nicely, I think.
Great, thanks. Maria, you want to tell us a little bit about, as you saw the field when you began working in it?
Yeah, so I think my exposure to thinking about implementation came through intervention mapping, and really early in my career when I came to University of Texas as a postdoc, they were already sort of teaching these processes about how to design health promotion interventions, and a really integral part of that process, and one that really attracted me, was this concrete, specific step of planning, which was planning for implementation. And one of the things that I thought was really critical about that is that it's something that people don't really think about often when they're planning interventions, and it's sort of an afterthought. Once it's developed, now we think about, well, how do we get it adopted, implemented, and maintained? And so I had very early exposure to this idea. But I guess in terms of a science, of a field of implementation science, it was really in the early 2000s, and I clearly remember an experience that I've told some of you. It was a conference in Corpus Christi, I think sponsored by NIH, on issues of implementation, and I was able to meet Everett Rogers in person, which was really exciting to me as a young faculty member at the time. And I was really intrigued with this idea of thinking about implementation, which I had been doing already, but as a science, and asking questions about what influences implementation, what are some strategies, and how do we develop strategies to influence it, and then issues around measurement, many other things that have become really important as the field has progressed. And then I think in terms of actually doing implementation science, it was really facilitated through my participation in the Cancer Prevention and Control Research Network, which was jointly funded by NCI and CDC as part of the Prevention Research Centers program, to really go beyond contributing to the gaps in the research evidence about what works to influence cancer control, and start developing research and interventions to accelerate the use of evidence-based cancer control innovations and practices and policies to have an impact on public health. So that was very appealing to me, and I think where I really jumped in full force in the field of implementation science.
Great. And so maybe starting with you, Maria, I wonder if you could just comment a little bit about how you've seen the field change over the years that you've been working in it.
Sure. Well, I think early on and appropriately, it was really, I think, focused on what are factors, identification of factors that influence the different phases of implementation. And I think that when you think about adoption, implementation, and sustainability as sort of this continuum of implementation science research, the real focus, I think, initially and perhaps still has been implementation. And so, and less on adoption and maintenance. But I think that the field early on was really focused on issues about what are some of the contextual and other factors that influence implementation, and I think that, and also things like fidelity. How does fidelity, a level of fidelity of the implementation, influence effectiveness? And I think that it's now evolved beyond that. And I know we're probably going to talk about what are some emerging areas in a bit, but I think that, yeah, that's sort of where it began, and I think that now it's maturing to look at strategies and comparative effectiveness studies that look at various strategies for implementation in different settings. Yeah, still a long way to go, but I think it's evolved quite a bit.
Cool. Greg, same question to you. How do you see the field having changed over the years?
Yeah, one of the things that I like best about what's happening in the field now is that some of these issues that we have dealt with for a long time, we're naming them, identifying the challenges around them. So, for example, just the idea of implementation strategies. We have a name for strategies now, so people can come around thinking about that, through the work of Noah Proctor and Byron Powell in that area. The idea of, how we have many frameworks, but how we kind of take those frameworks and hone in on what we think are the critical factors in the theory of change, whether that be at the provider level, clinic level, organization, or even system level. There's more, I think, understanding and more focus on theories of change and how we can use implementation theories and frameworks to drive and help inform our research practice. And then, a shift towards, I think, Maria, you're right on in thinking about the phases of implementation. But thinking of this continuum and where do we intervene in that continuum to get the best clinical or public health impact. So, one of the things that I say frequently when I'm giving talks now is to begin with sustainment in mind. So, even at the beginning, if we're thinking about the adoption decision, what impact will that have on ultimate sustainment of a practice or a public health innovation that we're trying to implement in the long run? And, hopefully the work that is being done in implementation science will also influence policymakers to think about this continuum. It's not just what we implement today, but, kind of the ongoing impact. But also in regard to how the field has changed, we've seen a lot of special interest groups within disciplines. So within cancer, within global health, within psychological science, we see these small special interest groups developing that help drive and support D&I research. And I think that momentum has really helped to shape the field and drive kind of pockets of innovation within the field.
Great, thanks. So just a sort of mid-stroke encouragement that, of course, if questions that folks have, it's a rather large group, so any questions that you have, feel free to put into the Q&A box, and we'll certainly take those as they come. You know, Greg, you talked about certainly the designing with sustainment in mind and trying to raise the profile of questions related to sustainment within the broader field. I wonder if you might talk about any other specific priority areas for research that you'd like to see. Again, we got a big group here, so that you would like to see the field think about taking on in their next set of ideas, studies, et cetera. You want to start us on that?
Sure. So, you know, I mean, much of my work has been focused on the inner context of organizations and across levels of organizations, but this interplay between system context or policy context and what's happening in actual service delivery and in implementation of new innovations, I think is critical. It's just becoming more clear to me that a focus on that interplay and how a policy decision might affect the way mandates are enforced and the way mandates, policies, funding, contracting, for example, can impact the way services are delivered. So, you know, interestingly, in 2016, the Nobel Prize in Economics was awarded to researchers who study the issue of contracting. Many public health services and public sector health and psychosocial services are delivered under contract. So here's an area of study that we can look at. What shapes an effective contract for bringing in evidence-based practice? How much specificity, for example, do we need in what requirements are instantiated regarding things like, you know, how an evidence-based intervention is used, how it's monitored, is there fidelity assessment, what's the quality with which interventions are delivered, and how do we know, and are there ways that we can have ongoing support to understand how evidence-based interventions are implemented, delivered, sustained with a high enough level of quality so that we get the intended health benefits.
Great. Maria, same question for you. Are there specific priority areas for research that you'd like to see more emphasis from the field?
Yeah, so a couple different areas. One I think is in approaches to systematic planning, and you know, I mentioned intervention mapping before, and I think that that's one, but certainly not the only approach. But I do think that there sort of has been a disconnect. If you think about like how carefully we develop innovations or interventions to change behavior or change environmental conditions that influence behavior, you know, really thinking systematically about what are the influences, what methods or approaches can we use to make changes in those, and then putting it together into some coherent intervention for change. I don't think that that same thoughtful, systematic approach has been used in the development of implementation interventions or implementation strategies. I think oftentimes we're sort of choosing from lists, and certainly we've gone a long way, and Greg mentioned the work of Enola Proctor and Byron Powell. I think that they've advanced the field tremendously in terms of their identification and categorization of strategies. But nevertheless, I think that we have to get to a place where we go beyond sort of picking and choosing and then just doing tests of comparisons. I think that more attention has to go into planning. And in order to do that, I also think that more work needs to be done on the theory development end. And you know, some people who recognize that there are many, many frameworks available for implementation science, they're probably thinking, oh no, not another framework. And that's not what I'm talking about. What I'm talking about is that the frameworks are incredibly informative, but there's still a lot of questions about how do the constructs within these frameworks influence each other and influence the outcome. I think there's a lot of work to be done in that area. And then alongside that observation, in order to do that, there has to be better measurement of these constructs. So I think that there has to be a greater focus on measurement development and assessment of how these constructs within conceptual frameworks lead to improved dissemination and implementation and also sustainability. And then perhaps some harmonization of these measures so that we're better able to compare across implementation efforts and settings and populations. And then another area I think of important growth would be in implementation science studies outside of the primary care setting. I think that, or a clinical setting. I think that there's still a tremendous amount of work to be done in the clinical setting, so that's not what I'm saying. But I do think that there's much more there than there is in other areas, in other organizations, in other settings. So I think more work needs to be done in terms of implementation of health innovations in schools, in social service organizations, in communities. So I think that's another important area of new research.
Great, and so encouraging, the continued, and thank you to those of you who have already jumped in, solicitation of questions. Wanted to, a related question, but more specifically, I think it was mentioned before, in this discussion about advancing the science of adoption. And the question, I guess, for either of you is whether one of you might talk more about promising directions in advancing the study of adoption. So still on that sort of front end. Any thoughts from either of you about that?
Sure. Let me jump in. I think this idea of adoption, and of course this goes back to what I was saying a bit earlier, the idea of influencing policy is a really important area for the study of adoption. So when we think of impact, if an individual clinician makes an adoption decision, that's going to affect, their clients, depending on the degree to which they have freedom to actually implement something in their clinical practice. If we can influence or understand the adoption decision at different levels, so for example, organizational leadership, a county health department leader or statewide system leader, or in low and middle income countries, health ministers. There's been a lot of work on trying to understand, the meaning of evidence and what is evidence, and how is that construed or understood by decision makers, and Larry Palenkas has done some work in that area, but also in how we package evidence from systematic reviews, from Cochrane collaboration or Campbell collaboration, for example, in a way that policymakers will be able to understand the research evidence and how it might impact individuals or populations that they're responsible for. So I think that adoption decision, we can think of it in this multi-level framework at that policy level, but also there's the Society of Medical Decision Making. There are a number of people there that focus on also at different levels, how are those decisions made? And so I think that can inform some thinking about adoption as well.
Great. So moving on to another question and another campfire. So you mentioned before, and I think Maria, you did, about, of course, there are a lot of different conceptual models. So the question is whether the panelists or, whether NCI, I can say we don't specifically, but whether there are favorite implementation science conceptual models that you might call people's attention to among the many. Any that come to mind that you'd encourage people maybe to start with? Maria, any thoughts there?
Well, I think that when you think about conceptual frameworks, there's probably advantages and disadvantages of all of them. I think that different frameworks can be helpful depending on what you're trying to use it for. I can tell you personally some of my favorites. I tend to use the Consolidated Framework for Implementation Research a lot, CFIR, as it's commonly called, developed by Laura Damschroeder and colleagues. And one of the reasons that I'm attracted to this framework is that it's very comprehensive. So like the name indicates, it comes from a compilation of many different frameworks. It builds on Trish Greenhall's work, and I think that it really does a good job of describing various constructs within broader domains, and domains things like inner setting and outer setting and characteristics of the innovation. So things that we've seen before in perhaps older frameworks like Rogers' Diffusion of Innovation, but bringing it together. And so I think that in terms of the contextual, thinking about contextual factors that influence implementation, that's one that I tend to gravitate towards. Another one is the Interactive Systems Framework developed by Abe Wandersman and his colleagues. One of the reasons that I really like this framework is that it really serves as a heuristic for understanding different systems that are influencing implementation and implementation effectiveness. And it ties into something that Greg said about synthesis and translation, which is one of the systems described in the framework, and the importance of being able to translate the evidence into something that's actually usable. But it also focuses on other elements of capacity, including the support system and the capacity that's important there, and also the delivery system, and both the innovation-specific capacity as well as general capacities that are important in influencing implementation. So that's another one. Motivation is also another factor that plays into that framework. So that's another one that I tend to use and look towards when I'm thinking about implementation, either understanding it or developing interventions to increase it. And then, of course, RE-AIM, Russ Glasgow's probably most widely used framework in implementation research. And I find that incredibly useful in thinking about implementation outcomes, thinking about reach and efficacy or effectiveness, adoption, implementation, and maintenance. It has really all the elements of what you're really aiming for when you're thinking about implementation. So those are some of the frameworks I think that I typically gravitate towards.
Greg, I wonder if you could maybe think about your interest in one that's exploration, planning, implementation, and sustainment. Any insights on that one?
Sure. So, full disclosure, so that's one that I co-authored with Mike Hurlburt at USC and Sally Horowitz, who's at NYU now. The features of that framework that I think we found useful and other large-scale studies have found useful, for example, the JJ Trials project funded by NIDA, which is 6 centers focused on implementing evidence-based care for adolescents involved with juvenile justice and substance abuse. And they've done a particularly nice job of thinking about how the phases align with actual activities in the implementation process. So, for example, in the exploration phase, thinking about how you engage with the various stakeholders and collaborators, both academic, community, service system, and how you move through that process of identifying, what the targets of improvement are going to be, what practices might be implemented, and thinking about moving into the preparation phase, really thinking about how you prepare for that implementation process and how you're going to measure and when and where you're going to measure different aspects of the process of implementation. So I think that phased feature as you move through the phases helps to just put some structure around the implementation process and can be really helpful in thinking about what occurs further on when you're actually implementing, And that's when I like to say all the things that we didn't think about in the preparation phase really come to the fore in that implementation phase, and then how we navigate and negotiate those into sustaining interventions. The other feature is similar to CFR, this focus on both outer context and inner context in their interplay, which has been, I think, critical in thinking about, how you move organizations or agencies through the implementation process. So even if you're focusing on the inner context of an organization, we have an implementation project now, implementing motivational interviewing and substance abuse treatment programs across the state of California. And there are internal organizational demands that have to be identified, leadership issues, building an effective climate to support the implementation of evidence-based practice, and that's happening within the organization. But on top of that, there's a state policy change around funding and reimbursement under Medicaid and Medi-Cal that's impacting how these agencies operate on a day-to-day basis. So understanding that interplay of what's happening in a clinic or program and how that's impacted by the outer context in that interplay, again, I think is critical, and that's another feature of the EPIS framework that I think we found useful. And it's not dissimilar to some of the issues identified in other common and popular frameworks.
Sure, and there was a related question just about different resources, and certainly there's a fair amount on NCI's implementation science website around resources for applicants. There's also the really nice related site, dissemination-implementation.org, which took a couple of the reviews of the many frameworks and tried to help people walk through what levels of change or what levels of implementation am I thinking about, what are the different models like those that Greg and Maria mentioned that will operate at those different levels, whether it's the organization, the individual, the sort of broader community, or even the broader environment. And so just to finish answering that previous question. A great question, the next one that I see right here, just asks both of you how you see the field of implementation science growing, with the idea that, might it be through current researchers, maybe clinical, behavioral, et cetera, who are thinking about integrating implementation science into their approaches to what they're already doing, versus the idea that you have specialists specifically trained in implementation science that would collaborate, reach out, and work with these other types of researchers. Any thoughts about the merits or whether it seems like we're in sort of one camp or the other? Maria, thoughts about that?
Yeah, I think it's not an either or. I think it's both. I mean, I think in implementation science, just like in any field, I think the greatest strides occur when there's transdisciplinary, thinking and sort of this team science approach where you're getting input from people from very different perspectives. I think that that's where we're going to have the greatest leaps in terms of advancing implementation science. As far as whether or not you have to have an expert or this trained cohort of scientists that are specific or exclusively implementation scientists versus scientists that are working in a particular area broadening their field, I think that either one, and like I said, probably both are really useful. I do think that there's a huge value in people who may not necessarily identify themselves or even want to be identified as implementation scientists to learn a little bit about what some of the issues, measures, considerations are, because it's only going to make the research that you're doing more usable and more impactful if you consider these sorts of issues, even if you're not specifically interested in competing for getting implementation science type studies or grants. So I think it's really both is what's going to contribute to the field the most.
Greg, any quick additions to that?
Sure, yeah, and I absolutely agree with Maria. You're building a team, and it's been interesting for me to work with intervention developers, both in HIV prevention and mental health, and coming in and working with those folks and thinking about and learning about their context in which they work, and bringing implementation science in as a piece of that, and having efficacy and effectiveness researchers have that aha moment about, oh, we can actually study these things, because in my last project, you know, for example, they'd say, in the last project, you know, we were trying to train these social workers to do this intervention, and it just wouldn't stick. You mean we can study how to actually do that? So that realization that this is a field of study, and that we can come together to kind of solve this problem about how to bring these effective interventions to scale has been really gratifying. And so, you know, those multidisciplinary teams, and thinking about, you know, the methods that you're going to apply. So having, you know, good collaboration between your quantitative and qualitative researchers, for example, to think about these issues from different angles as we go forward, I think is necessary. So you don't have to be one or the other, but bringing together an effective team is critical.
Great.
So I'm going to jump in really quick, and for folks on the line, a lot of frameworks and have been being mentioned and bantered around acronyms and things. If you all want to check the chat function, I've been updating it with links and some resources to find the information on the majority of everything that has been mentioned. So that, again, is in the chat function of the meetings area. And also, we are receiving a ton of questions, so we are going to move into a bit more of a rapid-fire Q&A to try and make sure we get everyone's question answered. So, Maria and Greg, I hope you're ready.
Yes, and so okay, good. And so with apologies for my effort to try and combine two questions, I'm going to see if I can do that for efficiency's sake, because they're both really wonderful questions, and I think there's some common elements among them. The first one really talks about whether there are worthwhile science questions relating to whether peer providers, for example, lay providers with lived experience of mental illness, may help the dissemination effort in certain areas of mental health, maybe less experienced but less expensive and less busy. So that's a more specific thought about peer providers' role in dissemination efforts of effective practices. And then a related question about your broader suggestions about building in more of a consumer perspective into implementation research, and a question about whether those are represented in existing frameworks. Maybe start with Greg and then Maria, thoughts about those?
Okay. So yeah, this is a great question, and what I would say is, in thinking about the peer provider issue, think about when, where, under what conditions, you know, would peer or consumer support or providers be most effective? What kinds of training are needed to support that process? How do they fit in the costing of agencies that provide services? You know, going back to the system level, you know, are there policies in place that would support funding for peers, and how do they fit into that process? And with the agencies that they work with, what kind of organization management structures would best help support peer providers in that process? So, I think there are lots of questions that could be asked in that regard. And then in regard to consumer perspectives, I think this goes back to, like the collaboration perspective. So, when we're thinking about our multidisciplinary teams, do we have people from the National Alliance on Mental Illness or Mental Health America, for example, or a local advocacy group helping to inform the research questions, think about the research designs, think about what the important issues there are. So I think as researchers, it's incumbent on us to drive that process and to create that opportunity to learn from the consumer experience and think about how that can be framed into either implementation strategies, implementation questions that'll ultimately, we hope, improve care.
and I'll just jump in. So I'm gonna sort of broaden that first question about peers. I think that when we consider any strategy for enhancing implementation, we need to ask ourselves why. Why do we think that this is going to work? And think about the underlying mechanisms of change that particular strategy is trying to influence. So are you trying to create a model, you know, and you think that this is a good way of doing modeling by using peers? Is it persuasion? Are you trying to demonstrate vicarious reinforcement, right? So these are all concepts that come from theories of change. And I think that how those are operationalized is a question that we have to answer, but we also have to be able to answer, why do we think this is going to work? What's the mechanism? That's a critical thing. As far as the consumer perspective, I absolutely think that this is critical. In intervention development and research, we often emphasize community-based participatory research. We recognize how important it is to get the perspectives of those who are going to be affected by the intervention. I think in implementation science, it's the same. We need to get the perspective of those who are making decisions about the adoption, those who are going to be responsible for delivering it, and those who are going to be responsible for maintaining it over time. And those may be the same people or they may be different, but it's very important to identify those folks and to include them in the process as you're planning your implementation. So I think a consumer perspective is critical in this. I know Nina Wallerstein has done some good work in terms of thinking about and writing about CBPR for implementation efforts. So I think that's critical.
Great. So I'm seeing a couple of different questions and a new campfire to go with it related to the locus of review. Each of you, I think, has different experiences serving on different study sections. Greg, I know you've taken part in broader study sections than just implementation science, but where implementation science applications have come. And Maria, I know your service on the specific dissemination and implementation research and health committee that the Center for Scientific Review funds has been very helpful toward making sure that those grants have the right expertise as they're looked at. I wonder if each of you could talk a little bit about how you see some of the decision for an applicant coming, whether you would go more specifically to the DIRH committee, or you might think about, if I have to go to another committee, how I might couch that application where I don't necessarily know that everyone on that committee is focusing or has that specific expertise around implementation science. Again, I'm kind of morphing a few questions into one. So Maria, do you want to start either perspectives on what DIRH looks for, or even perspectives about choosing that kind of specialized review committee versus a general one?
Yeah, I would say that if the study that you're thinking about is really addressing a question about implementation. So if you can say that, based on this study, not only are we going to be addressing a need and perhaps increasing reach, et cetera, but we're also going to be informing the science of implementation, then I think that it would fit really well to be reviewed by the Dissemination and Implementation Research and Health study section. That study section is made up of folks that have a lot of different content expertise, but also have this sort of background knowledge and experience in implementation science. If on the other hand, and now having said that, I will say that, David mentioned the hybrid designs that are really combinations of effectiveness and implementation. And so, given that all of those are acceptable to be reviewed, I would say that the decision point about when you have something that's more effectiveness, but you're also looking at implementation, is there a question about implementation? If there is, then I think it could appropriately go to that study section. In terms of submitting applications for review, but to other study sections, but still including an interest in implementation, I would just really clearly articulate in your application why you think that's important and how observations, measurements, or even questions about implementation within the overall study is going to contribute to a greater impact of your study.
Greg, any quick thoughts on that too?
Yeah, again, I agree with Maria, very nice summary. Yeah, having gone to both DRH and reviewed on DRH before it was DRH, when it was a special emphasis panel, and then on services review committee, and then specialty committees for other institutes like NHLBI, and the issue of implementation and implementation issues are becoming more recognized as something worthy of study in themselves on committees outside of DIRH. And there, I keep an eye out for special calls, if depending on what the substantive area or disease area you happen to work in from agencies, and respond to those typically that are reviewed by special emphasis panels, but also thinking about the likely makeup of a review panel. So if you're going to an interventions committee with some implementation ideas, I think really articulating the importance of the implementation piece, and as Maria said, how learning about that and understanding that, or testing some strategies to support effective implementation, will increase the likelihood of positive impact. So making that case clearly and succinctly in your application is going to be critical.
Great. Another question about generalizability, and that the observation was that it sounds like both of you have done work outside the U.S., and the questioner is wondering how applicable you found the lessons we have learned in U.S. contexts to these other settings.
So I'll jump in, and I think that's an empirical question. So for example, a scale-up model that we developed here in California called the Interagency Collaborative Team Model, where we scaled up evidence-based intervention across a large child welfare system. Now, Teresa Betancourt, with funding from NIMH and the World Bank, is testing that scale-up model with a psychosocial intervention for traumatized adolescents in Sierra Leone, Africa. The plan to test that model in these other settings, it goes back to the idea of your conceptual model, the framework, and now I'm not talking about the larger framework, whether it's CFR, ISF, FS, REAIM, but how elements of those frameworks, how your theory of effective implementation, how that will operate in another setting. And again, I think that takes an understanding of the outer context and inner context, and the interplay between those as you're tailoring your implementation strategy that may have been developed domestically here for another setting. So again, being explicit about those mechanisms of change and thinking about how the principles of your theory and of implementation are going to operate in that new setting.
Great. With only a few more minutes, about 10 minutes left, I'm going to move on to the next question. And certainly we see costs show up in lists of implementation outcomes, at times in different frameworks. And the question asks what each of you think about the roles of costs in influencing adoption, and more specifically, from whose perspective these costs, I guess, reside or maybe do, I suppose. Maria, any thoughts about that? The role of costs in influencing adoption?
Yeah, I mean, I think it's critical. Many times, we already know that when you look at studies that have looked at factors influencing decisions about implementation, or in fact implementation success, resources, including costs, is one of those critical factors. And And so what do we need to do about that? Well, one of the things is that we need to include more cost effectiveness and probably more importantly, budget impact analyses in our intervention development, but then also in looking at implementation approaches or implementation strategies. I think that there's not enough that's done, and we don't know enough about the potential impact of certain approaches or the comparative budget impact of different approaches. So I think it's critical, and I think that it's an area that is ripe for more research.
Yeah, and I think that point about how sometimes we traditionally in cost effectiveness studies have looked at societal costs, but I think what you're pointing to is the idea of really, the impact on whose budget, right? That different people or different organizations are being asked to bear the cost, and we can't just think about society may benefit, it may cost society, but to what degree does the budget or the costs, are they felt within or by different organizations, I think is great. Want to go to another question that again was mentioned in the way in which we framed the session, and that was just around review of publications. So I wonder if each of you, maybe starting with Greg, have any guidance for researchers who are looking to submit their publications, either specifically in the journal Implementation Science or other venues, and whether the ability to publish articles related to implementation science has changed in recent years. Greg, any comments on that from your perspective?
Yeah, so I'll take the last point first. I think it is getting easier to publish implementation studies. There are more outlets, more journals that are putting the implementation studies in the mix. In the interest of time, I'll just mention that the journal Implementation Science this year came out with an editorial. Paul Wilson is the lead author on enhancing the reporting of implementation research, and specifically, we note that the journal IS has over 750 submissions, but publishing about 150 a year. But really, the main issues that impact initial kind of consideration are the scope of the study and scientific quality. So really, those are driving those decisions, but it's also, focusing on the implementation of interventions with demonstrated effectiveness are really seen as the main types of studies for implementation science. But that's not to say that a well-designed hybrid type 2 or 3 would be considered for publication, but there's less interest, for example, in hybrid type 1s, where the focus is really on effectiveness with just some observation of implementation factors. So I would just encourage people to take a look at that and then think about other journals in their substantive areas where you're starting to see implementation science studied. And then, there are, new considerations of standardization and standards for reporting of implementation studies that, Maria, when we were talking yesterday, you mentioned. Maybe you'd want to pick up on that.
Yeah, so there's a recently published guidelines. It's called the Standards for Reporting Implementation Studies, or the STARI statement. And I think it does a really nice job of, they actually publish a checklist comprising 27 items. But it basically prompts researchers to describe the implementation strategy, so the techniques that were used, the effectiveness of the intervention, things like that. But I think that it's a really useful resource to look at and see what should be included in your write-up of an implementation strategy. But it also can be useful for grant applications when you're thinking about, well, what would be important for me to describe as I propose this particular study? So I would encourage people to take a look at that.
And then just note a couple of comments from Paul Estabrooks about how preventing chronic disease, as well as medicine and science and sports and exercise, have both recently added more of a focus around implementation science and sort of translational research related to D&I. So I think the venues seem to be growing over time, just seeing the thematic interest in it. Given that we have people at different stages of their career, I wonder if you each might comment briefly on advice that you have for early career investigators who are contemplating a career in implementation science. Maybe Maria, thoughts that you have, and then Greg?
Sure. I think that there's several training opportunities, including really excellent institutes, and I don't know if we could link resources to those, but one of them was, I think David mentioned, is TIDER, and then another that I know of and participate in is Ross Brownson's MT-JIRC, Mentored Training of Dissemination, Implementation, Research in Cancer. These are just examples of training opportunities that are competitive. People have to apply and be accepted to them. But there's also many other opportunities popping up at different institutions where it's like a 2-day training or other kinds of training programs. So I would look for that, because I think starting off, some basic introduction to methods and frameworks and design, measurement, that these are all very important foundational topics for anyone that's starting off in this area. Of course, Ross Brownson and colleagues' textbook on dissemination research, I think, is another really good resource.
Great. Greg, thoughts for early career investigators?
Sure. On mental health and psychosocial behavioral health side, there's the IRI, Implementation Research Institute, funded jointly primarily by the NIMH, but also National Institute on Drug Abuse and the VA, that focuses on mental health. Another example. The other thing that I think we're starting to see is some T32 fellowships. So fellowships focused on implementation science at various institutions. I think University of Pennsylvania received a good score. I think they got funded, and we're starting to see those opportunities as well. Plus, there are online resources. So, for example, the NCI webinars is a resource. But I would say, just try to immerse yourself a bit in the literature around implementation science to get a sense of the breadth of the field. And some of the summaries and review articles, like Rachel Tabak's review of implementation frameworks is good. Work on strategies, these kind of broader issues of measurement and understanding, how things differ in implementation science or focal differences, and looking at the journals that are publishing implementation science papers and really kind of reviewing what's being published, what those areas of interest, and find what excites you about the implementation process, whether it's changing provider behavior or changing service systems, or working with intervention developers to design for dissemination. Find what excites you in the field and go for it.
And I would also just add that a lot of institutions have CTSAs, Clinical and Translational Science Awards, and many of them include an implementation sort of focus and sometimes training.
Yeah, that's a great point, Maria. And so our CTSA and the Community Engagement Corps, we're funding implementation science pilot studies. So look for those opportunities as well.
Yeah, and so I see that there is a quick question about summarizing the resources listed. I think if you look through the Q&A, you'll see throughout Sarah's been trying to capture them. We certainly have more around our implementation science website. There were the other, whether it's the CTSA related portal that the University of North Carolina at Chapel Hill has additional resources, and certainly you can always feel free to connect with us at NCI about any specific resources that may be helpful. Given that we're just short of the top of the hour, I'm going to turn things over to Sarah, but first certainly say thank you to Maria, to Greg, and to all of the wonderful participants with your questions, and hope that we were able to get through as many as we could, but now turning it over to Sarah to close us out.
And again, I'd like to say thank you to Maria, Greg, and David for their time today in this very sort of lively discussion. With that, I'd make note that your feedback is important to us, and we encourage you to complete the online evaluation. A link to this survey will open in a new window once this session is concluded. An archive of today's session will be made available shortly on our website, and we hope to see you at our next session to be held in June. Registration details to be shared in the coming weeks. Thank you again for joining us today. You may disconnect at this time.
Thank you.
Thank you.
Yeah, that was great, guys. Thank you so much.